I once knew a woman who loved to hunt rocks. She told me that she would spend all of her free time out in the wilds of California looking for fossils and looking for artifacts. And when she talked about her activities, she always seemed to smile. But when I first met her, she wasn't smiling at all. She had just come off of a gigantic disaster and was trying to rebuild. She worked in law enforcement, and I met her shortly after she'd been arrested for driving a car while impaired. She had been taking pain medications for an injury that she suffered on the job, and she had been on these medications for quite some time. She was highly functional. She went to work every day. She did her job. From outward appearances, she seemed to be having no problems with the medications at all until she got arrested for driving under the influence. And then it became clear to her she was having problems with these medications, and she made the decision to discontinue on her own. Nobody put a gun to her head and said, quit these medications or else. She'd already experienced the negative effects of these medications, and she made the decision to stop. And that's when I originally met her. She came in to discontinue medications. She didn't really have a plan beyond that, other than she needed to keep her job, and the medications had nearly ruined her career. I'd actually seen a lot of patients like this in the past. I'd worked in functional restoration programs where a big part of the activity was discontinuing medications. This was many years ago, at a time when people took extremely large doses of opiate medications. They often mixed them with benzodiazepines or with soma in order to control pain. The medications were freely prescribed. The federal government had very little interest or involvement in these medications. We didn't bother counting pills. We didn't do urine toxicology. We just treated pain as a fifth vital sign, and we prescribed medications. It was what we did. It was what we thought was right. And nobody really ever talked about long-term consequences of these treatment decisions. But this patient, Lisa, she experienced significant long-term consequences from those treatment decisions. She was upset that she'd been arrested. She'd been arrested by colleagues. She was facing disciplinary action. She was looking at really the disruption of her entire life, and she made a proactive decision that she needed to stop taking pain medications. I wasn't in the detox business, but I did treat patients with pain, and I did deal with these medications on a daily basis. So she came to me with one goal in mind: stop the medications. So we accommodated. I started slowly weaning her from the medications. I did the hardest one first. We got her off the benzodiazepine. She was taking Xanax. And then we started with the opiate medications. And at that time, we discontinued medications rather rapidly and from fairly large doses, as I've said. She was successful, but there were a lot of add-on side effects that came along with it. I see a lot of comments from people who are very upset that they can no longer get opiate medications. And they blame a system, or they blame a doctor, or they blame the world for their situation. But their situation is the reality now. And so railing against it seems to be counterproductive. There is a very wide spectrum of pain control, from, on the one hand, doing nothing, to the other hand, being under a general anesthetic. It's very possible to completely turn off all pain. Anesthesiologists do it every day in the operating room. They can put you to sleep. You can have a belly surgery, and you can be totally unaware and experience no pain for the whole time that the surgery is going on. And then they wake you up and you're back to living life. We decided as a society and as a species a long time ago that that really isn't an ideal way to live your life. If you're insistent on complete pain control, you can actually have a general anesthetic and sleep away all of your days, and you'll be pain-free. Another approach that I've actually seen used is a surgery called an anterior cingulotomy. It's where they cut out a piece of your brain that connects the pain experience from the pain emotion. And without this track, you don't care about the pain that you feel. You feel it, but it doesn't really bother you. And it's very strange to talk to these people, because they'll tell you that they're having a lot of pain, but if you ask them outright, does it hurt? They'll say yes, but it doesn't matter. They carry on their lives. They don't worry about the pain. Both anesthesia and cingulotomy sound like pretty terrible ways to live, if you ask me. So what we noticed with my rock hunting patient was as she discontinued her pain medication, she actually started to regain interest in rock hunting. And she started to come in and tell me about the activities she'd been involved in the month before since I'd seen her last. And she got stronger and stronger, and she went farther and farther afield, and she used to bring in artifacts that she'd collected. It was really pretty cool to see what she was doing. At first, she didn't notice the big change in function, but eventually she brought it up. She said, "This is crazy. I haven't been able to do these things for years. Do you think that it was just stopping the pain medications that allowed me to do this?" And I told her the truth. No, I didn't think that that was the only reason that she was able to get back to physical activity. I think it was a big part of it, but what was more important was her intention, her locus of control, they call it. She had gone from making the pill responsible for her pain control to being responsible for her pain control herself. She didn't go through a pain program and learn about pacing and learn about distraction and learn about refocusing attention. She sort of figured these things out on her own. But what she did, which was very similar to all the other patients that I've seen that do well with structured functional restoration programs, is she took back control. She was no longer asking for a pill to solve her problem. She'd figured out how to do it without the medications. She was highly motivated to figure out how to do it without the medications, but nevertheless, she did it. And as she did it, she regained interest in her previous life. She got more and more functional. She got stronger and stronger. And eventually, she was able to return to full duty. She was not impaired. And she went on to have a successful career. Not everybody goes on to have this sort of success. But the people that don't go on to have this sort of success almost always do two things. One, they stop moving. They stop doing physical activity. And two, they start to rely on medications again. And I've seen some patients more than once who get off medications, get back to function, and then relapse and come back on medications, and they're no longer functional. And you can tell them, look, you already did this once, you know how to do it. But they didn't actually do the hard stuff. They didn't internalize the control. They didn't take back the control from the pain pill. And this is what separates success from failure when you're trying to stop medications. And here's the reality of the world today. Those medications are not easily available. This has happened because the federal government has changed the rules for how the medications can be prescribed. They've also changed the reporting that's required surrounding these medications. And finally, they have created a situation where there is enormous risk to practitioners who prescribe these medications. If the federal government decides they don't like the prescribing habits of a doctor, they don't come and say, "Doctor, we don't like this." No, they show up in force and they arrest you. And then they take you to jail. And then they charge you with federal crimes. And there's no going back. Even if you're right, even if what you were doing was okay, and even if you win your court case, you're destroyed because it's all over the news, it's all over social media that this was a bad doctor who got arrested for prescribing pills inappropriately. There will be lots of patients who will come along and say, "Yeah, that doctor just kept giving me pills and I was hooked and I was taking them day after day after day and they weren't helping me and he made me take those pills." Those are the people who have an external locus of control and they're going to turn around and pile on anyway. So there's no real reward in giving out pain medications, but there is enormous risk in prescribing these medications. And that's where it all went. It's gone because the government decided they wanted it to stop. And so it stopped. I have my opinions about these medications. I really don't think they help most people. They help some. There are times when they are appropriate for use. Usually in the short term for pain control with an immediate problem. But what we found is over time, they don't seem to be all that beneficial. They don't seem to improve function. They don't seem to improve pain control. And they do seem to cause a whole lot of problem, not just for patients now, but also for the people who prescribe them. And so I wouldn't spend a lot of time railing against a system that won't provide you these medications any longer, unless you want to become a lobbyist and go to work on Capitol Hill and convince enough lawmakers to change the rules and make it more permissive again. But being angry because they're not available seems counterproductive. Rather than being upset about a tool that's no longer available to you, maybe it would be better to find different tools. And that's the whole point of what I do. It's not to just write a prescription and make you feel better. It's to point you in the direction of a completely different toolbox that may help you get back to hunting rocks or running half marathons or doing what it is you used to really enjoy doing before pain took over. I'm not judging your pain, and I'm not saying I don't understand your pain. What I'm saying is your pain is your reality right now. Here are the tools you can work with. Here are the tools that are no longer available to us. And how do you want to proceed? Something to think about and something to consider. And if you want to learn more, check out the links below. I'm not here to sell you something that you don't want, but I am here to give you a whole other toolbox to work with if you're interested. Thanks for watching.